Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Hello viewers, welcome to this week's episode of Health Watch on Advent Cable Network Nigeria. I am Angela Mweze. In recent times, all over the world, there has been an increase in talks about mental health. Governments, medical institutions, even celebrities are weighing in greatly on mental health. Why is mental health suddenly a big issue? Let's look at what the numbers are saying. According to the World Health Organization, there are currently over 450 million people living with some form of mental or neurological disorder. That means 1 out of every 4 persons has a mental disorder. This has placed mental disorder as the leading cause of ill health and disability. In Nigeria, an estimated 20 to 30% of our population are believed to suffer from mental disorder. This is very significant considering that Nigeria has an estimated population of over 200 million persons. So we're looking at about 40 to 60 million persons. In the next couple of episodes, we shall be discussing different mental disorder, their treatment and prevention, if any. On today's episode, we shall discuss mental health in general, and at some point, we will discuss anxiety disorder. You will need to stay tuned to get an understanding of anxiety disorder. My guest on the program today is Dr. Olusegun Shoyombo. He is a consultant psychiatrist with the National Hospital, Abuja. Doctor, you're welcome back to the program.
Thank you, Angela. Always a pleasure to be here.
So good to see you. You know, the last time we talked, we discussed this, depression extensively, and that was really amazing. And I still watch it today to learn a lot from it. So today we are going on the umbrella of it all, and that is mental health. All over the world, there's so much noise about it now. You know, I think recently, one of the big celebrities, Oprah Winfrey, you know, and one of the Prince of England, they just started the campaign on mental health and, you know, trying to help people know about it. And I'm wondering, mental health, how come suddenly we are talking about mental health? You know, not malaria, not HIV, not, we're just talking about mental health. So what's going on? What exactly is mental health? Let's start with that. That's making it so important.
Well, for one, I am happy that we are now beginning to have a lot of conversations centered around mental health. It used to be the hush topic, you know, the one that nobody wanted to talk about, nobody wanted to admit that they had a mental health disorder. So it is good that we are beginning to talk about it because it affects a significant proportion of the population all over the world. So it's good that you have celebrities who are weighing in on it, lending their voice to promote mental health. Why are we talking about it now? Perhaps this coronavirus pandemic has brought the problem of mental health more to the fore. Okay, you have a lot of anxiety around infections and around a lot of, you know, you keep hearing figures, this also number of deaths, also number of infections in this kind of places. People with pre-existing conditions can't go to hospital. You know, during the lockdown, people didn't have access to services and things like that. So I think all of this has brought it more to the fore. Of course, you cannot take away the personal experiences of these celebrities who are weighing in. They've gone through personal challenges in their lives, and it's a very good thing that they are coming to the open to let people know that they've gone through stuff, and then they are using their influence to promote mental health. You know, a lot of attention used to be placed on our physical health, but there is no health without mental health, and that was the theme for the WHO in a particular year, okay, because the definition of health itself includes mental health. Health is not just the absence of disease, but it's a complete physical, psychological, spiritual, social well-being of a person. Okay, so you can't talk about health without talking about mental health. Yeah.
So well, we've seen how important it is, and they're weighing in, people have experienced. But when you talk of mental health, is there a definition? You say this is mental health.
Yeah.
Is it just being happy and everything is okay with you? Does that mean you're mentally all right?
It is the very essence of our being. Every human being wants to contribute to industry, to society, wants to fulfill potential, wants to fulfill personal dreams and be useful to society. All of this encapsulates what mental health is, because for people who unfortunately have to live with mental health conditions, if they have severe conditions, they may not be able to achieve some of these things, just as much as somebody who has a serious physical health condition may not be able to achieve his potential. So mental health is an umbrella terminology. Nobody talks about other aspects of health. We'll talk about health, and then we'll talk about mental health. The reason why it is worth mentioning is because it can easily be forgotten. When you tell somebody to go for a checkup, what do we check? Blood pressure, blood sugar, HIV, hepatitis. Those are things that all have to do with physical health. How many times do we remember to check the psychological health of a person as part of a health
So you can check psychological health
Oh
of a
yes,
person.
absolutely we can. So that is why it is worth a separate mention. You know, it's such a large umbrella. It covers such a large number of conditions that people have to deal with. But it is particularly worth mentioning because it can easily be lost in the mix of other conditions. In your introduction yourself, you asked, why are we suddenly talking about it? Why not coronavirus? Why not HIV? Why not malaria? We've talked about all those things over the years, but we are seeing that mental health is just as important because we see people die of suicide. We see homicides that could have been prevented, maybe if certain mental health conditions had been discovered. You have people who cannot achieve their potentials, maybe in education or career or marriage or society and things like that. So it affects a whole lot, and it's worth that separate mention.
Okay, now that's bringing it home now. You know, when you use the word mental, I don't know, you're a professional, your experience will be different. When you say the word mental, everybody, the first thing that comes to everybody's mind is you are not normal. You know, you're acting abnormal. You know, so you see someone say, this person don't call, this person, something they do for brain. You know, that's the general definition. I want to try to see how we can take that off the minds of people. That it's not, when you say mental, it doesn't mean something is wrong with you or you're running around on the road. You know, I think the TV these days or the home videos have taught us more or sent out more information about mental health than even people know. So that's what I'm just trying to say. I don't know if you get my question. Let's try to disabuse this thing. Like, when you think mental, is not something is wrong with you.
Now that's very, very important to disabuse the minds of people, and I'm particularly happy that you mentioned the home video, because the opinion, the idea of people about somebody who has a mental illness is somebody who runs naked or wears rags and is dancing around the street. That population constitutes a very minute proportion of people who have mental illnesses. The vast majority of people with mental health disorders will not wear rags, they will not run. If you were to come to my clinic, you will see very well-dressed ladies and gentlemen, married, working with children, contributing to industry and things like that. So that idea absolutely has to be disabused, okay? Now we can play around with terminologies. You go to some places, they say it's Department of Psychiatry. You go to some places, you say it's Department of Behavioral Medicine. You go to some places, they say Department of Psychological Medicine. All of it is playing with words such that we find something that is more agreeable, that doesn't have that stigma attached to it. Personally, I'm comfortable with using mental, I'm comfortable with using psychiatry, but we have to continue to educate the people. And as people listen and they know that, oh, this is not just about running naked on the street. Mental health conditions can include sleep disorders, anxiety disorders, you know, panic disorders, bipolar,
even the depression,
a lot of things, eating disorders, there are a lot of adjustment disorders, bereavement, okay? There's normal grief, there's abnormal grief, okay? So there are bereavement disorders. So there's a vast number of conditions, so that people just have to disabuse their minds, okay? Yes. And then so that when you hear mental next time, you shouldn't be thinking, oh, it's colo or it's this or it's that. You know, don't know that sort of
because that's what goes in the mind of people. But let me see. I'm trying to think of how do we distinguish being happy? Just if you say somebody is you're mentally healthy, doesn't mean you are happy and everything is going well for you. Then it means you're mentally healthy. Is that, you know, like if you say, okay, when you check your blood pressure, it's okay.
Yes.
When you can wake up in the morning and go about, then you're okay. Is that the same thing with mentally healthy means I'm happy?
Well, I think I get your question.
Yeah.
And the first thing I would say is that mental health is not static.
Okay.
It's not a point that a person gets to and remains there. Okay? It involves our emotions, our thinking, our behavior. Now, either or any of these things can have a problem at any point in time. That you are happy in the morning does not mean you'll be happy at night. And that you are unhappy at night does not mean you are depressed. Okay? Because there are things that can make people unhappy naturally. That you are very excited does not mean you have a mental illness. That you have a few nights of not being able to sleep well does not mean you have a mental illness. So what I'm trying to say is that it is not static. Okay? It's not a destination that a person arrives at. Okay? However, generally speaking, we'll say that when you feel, you know, when things are together, you are happy within yourself, you can meet your day-to-day duties, because that's very important. Before we say somebody has a mental health disorder or a mental illness, how has that illness affected the functioning of the person?
So the day-to-day functioning of the person.
The day-to-day functioning, the day-to-day interactions. You see, it's an illness that the person who feels it usually knows how it has impacted on him or her. For example, we say somebody has malaria. Malaria might be mild. You can go to work and tell your colleagues, oh, I'm taking anti-malarial, I'm just feeling a little bit tired. Or it can be more than that, such that you need a medical excuse duty where you have to stay at home, or maybe you have to be admitted into hospital. So mental health is also such a wide range. There are people living with mental health conditions that can function day to day. They take medications or they go for psychological interventions, they have counseling and cognitive behavioral therapy, and they function day to day. There are those whose conditions prevent them from being able, they might be in school and then they have to stay out of school for a while, or they have to spend extensive periods away from work, you know, because, and again, I like to draw the parallel that everything that happens with mental health can happen with physical health. If somebody has poorly controlled diabetes, for example, the person may not be able to go to work for a long time. The person may be admitted in hospital and be on hospital bed for a long time also. So there are parallels. However you look at it.
So linking it now to physical disability, because one of the things, I've read it severally, and they say it's becoming mental health, because there are lots of them, as we keep saying, but mental health is one of the things that leading cause of disability. All my life I've been hearing, oh, diabetes, oh, the physical one is, but now everybody tend to link everything to the, if you're having this, then there's something wrong with you mentally. How do we link the state of our mental state with our physical health?
Let us pick it from it being the leading cause of disability. Again, it is worth mentioning because it is not readily visible. Okay? If two people working in the same place have different conditions, one has a boil on the front of the head and is very big and red, okay? The supervisor may come in and say, you have this boil, you have a fever, you have a headache, go home, okay? And then the other person has, say, anxiety or depression or some other condition that affects his ability to concentrate and do his work. And then the supervisor comes and says, what's wrong with you? I gave you this job, you've not done it, you get a query. You see how it's a cause of disability, and it's a silent cause of disability that many people miss, and patients suffer unnecessarily.
I see.
Also because sometimes it creeps in. The person suffers, the work suffers, relationships suffer, but the person is not taken to hospital. If somebody has a stroke, the person falls down, everybody rushes the person to hospital. Nobody is asking for excuse duty. Nobody is saying when is it coming back to work. But the person who suffers from a mental health disorder may not have such luxury. How about a condition that makes somebody come to work and then begins to quarrel with everybody, accuse this one of that, accuse this one of doing this? Nobody immediately sees that something might be wrong here.
It's a character problem.
Yeah, it's a character problem. This guy is
issue.
pompous. This guy is just rude. This guy is just, you know, and then queries are flying left, right, and center. The person might be laid off. They can even tell security, throw him out and things like that. Okay, so it's a leading cause of disability. Again, people with mental health disorders need a lot of support. Many people who have hypertension, who have diabetes, will go to hospital and attend clinic by themselves. But many people who suffer from mental health conditions probably need somebody to accompany them to hospital. Now, if Mr. Hay, who suffers from a mental health condition, takes excuse from his boss to go to hospital, Mrs. Hay, who is going to accompany him, what excuse will she get from her home boss? So she spent time off work or off her business to take her child or her husband or his wife or his child to hospital. Okay, so you are not looking only at the disability or at the work hours lost by the ill person, you are also looking at the caregiver. So that brings us to the issue of caregiver burden, which is also a major discussion when you talk about mental health.
Wow, so it's not even just the person who is the one that's suffering. There are other people.
There are other people.
Wow. Now I understand when they say, because we have, when I was in the research for this, one thing I noticed was there's nobody says, okay, this is the exact figure, because it looks like it's underreported. So everything is pretty much an estimate because not many people want to talk freely about. I even remember a celebrity who had, I can't remember the ailment she had, the mental condition she had, but she struggled so much and she didn't come out to talk about it. But when this awareness started, she eventually opened up and said, look, I was having this issue at that particular time.
You see, that's also very important, because a lot of times when people are suffering, they may not necessarily know what is making them suffer. Okay. And when you don't know where to ask for help. So let us look at children, for example. Reading disorder. Some people with specific problems with mathematics. You know, some people are just dyslexic. Okay, some people have
the
autism.
Painful one that I heard.
Autism, attention deficit hyperactivity disorder. What do you have? Teachers beating this boy, telling him to go and stand up and face the wall, telling him he will not go on break as punishment. Nobody has identified that this could be ADHD. This could be an autism spectrum disorder. Let us get help for this child. How many teachers are trained to handle special needs children? Because we no longer want special needs children to go to special schools. We want them in mainstream schools. We just want the teachers trained in how to deal with special needs children. But when you don't even realize it, sometimes diagnosis is not made until the child is in SS3 or university, and he has had bad results following him from primary school that could have been prevented if he had had the proper diagnosis and intervention at the right time. So again, you see disability where it's coming from.
You know, what you're just reminding me of something I watched about dyslexia. You know, it's most teachers don't know. They just think the child is not smart, he's not intelligent, he's not catching up. But you know, it's a different kind of training to handle that. Wow, that's just bringing to fore a lot of things. But before we move any further, I just want to ask this question. I think I asked you earlier about the difference in the doctors that handle the treatments for mental health. Now there's the psychologist, there's the psychiatrist. Well, you're an advanced psychiatrist, and then there's I think the psychotherapist. I don't know where that one falls, but what's the difference in this? Let's say professionals that handle, you know, people that have mental health.
Yeah, people who have, it's a multidisciplinary team that takes care of patients who have mental health conditions. Okay? So the psychiatrists primarily are doctors.
Okay.
Before somebody is a psychiatrist, he is first and foremost a doctor. A medical doctor is gone to medical school and graduated, and then decided to specialize postgraduate as a psychiatrist.
Okay.
Psychologists study psychology ab initio. So psychology is a degree. It's a, you know, the ways you go and study medicine, somebody else can go and study psychology. And it's a discipline that also has a lot of advanced stages. Okay? So you can do it as masters, you can do it as PhD. People do psychology and then they sub-specialize. Okay? Not all psychologists come and work in hospital to treat patients. They are occupational psychologists.
Okay.
They are sports psychologists who are just there psyching up people to get them to perform better. Well, to perform better. And then we have the social workers. Okay? Because in dealing with these patients, their social circumstance contributes a lot either to the cause of their illness or to how well they respond to treatment. Okay? Sometimes we have to go and visit where they live. Sometimes you have to go and physically investigate their living conditions. Otherwise, the medications you are giving, you won't get the result that you want. You are treating somebody for a substance use problem, but he lives in a beer parlor, and everybody comes there to buy drugs, and he is the chief distributor of the drugs, and then you think you are counseling and giving medication. So you have the social workers. We have the occupational therapists.
Okay.
Because the essence of treatment is to achieve as much independence as possible.
Okay.
Okay? We are not treating so that you become you, the patient now becomes my son that I'm 100% responsible for. We want you to get well, we want you to move on with life. So we have the occupational therapists, because a lot of times people who have mental health conditions might have fallen back. Okay? Maybe their mates have graduated, gone on to do service, are working, they've not been able to finish secondary school and things. So you have occupational therapists who are able to look at each individual and look for their areas of strength. And then they can say, let us teach this person catering. Oh, this person can learn woodwork. This person can learn this. Not only do they teach, they support them in starting a career. Okay, you can identify those who can go on to work independently, and then those who, well, have to work under somebody and still need some measure of support. So it's a wide range, and of course you have the nurses. Okay. Nurses also train primarily first as nurses, and then they go up and specialize as mental health nurses. Okay, so it's a post-basic qualification for nurses. So you have all of us working together. You mentioned psychotherapists. Well, psychotherapy, now, in treating patients with mental health conditions, it's not all about drugs. Okay? It's not all about writing medications. We do a lot of talk. Okay. I call it talk because that's the simple thing, the simple way to describe it. But it's psychotherapy, psychological therapy.
So everybody can do this? Or we can be trained to do this?
Yeah. So usually the psychiatrists, the psychologists are trained to provide psychotherapy to patients. Okay. Where you try to, using interactions with the patient, you try to look at the thinking, the behavior, and you look at areas where you can change. You look at problems, and then you see what interventions you can make. I will give an example. In depression, for example, people have what we call cognitive distortions. When I come on shows like this, I don't like to speak big grammar. What that means is that they have certain ways of thinking that fuels that depressed mood. Okay. So, for example, somebody can say, I can't even pass an exam that everybody passes. You see, I'm a useless person. I'm the only one that failed this exam. So when he has a negative experience, he blows it out of proportion. But guess what he does when he has a positive experience? That lecturer just decided to pass everybody.
Always negative.
He will not take credit for passing the exam. He's taking the full blame for failing it. But when he passes, he doesn't want to take credit. Oh, he's the lecturer. So the psychotherapist is going to come in and try to correct this pattern of thinking, just as an example. Okay.
All right. So now we're going to go on a break. But when we come back, the season we are in is the COVID-19 season, and there's a lot of stress on families. Maybe we'll just touch a little bit on that, the stress on how families can manage this season. Let me just, since I was able to get you today, let me squeeze that information out of you today. Let me squeeze that information out of you and then give our viewers. I know they'll gain a lot from that. So we'll go on a quick break. We'll be right back, viewers.
We all have mental health. It is just as important as physical health. It is not only about mental illness or mental disorders. This is just one part of a bigger picture. It's best to think about mental health as being on a continuum, rather than people being either mentally ill or mentally well. We are all on the continuum, and we move up and down according to factors such as our genetic makeup and upbringing, our life circumstances, and the stresses we are under. At one end of the continuum, we have mental disorders, like depression or anxiety. And at the other end, we have states of positive mental health, when we're thriving, content, and fulfilled. The aim of mental health interventions is to move people up the continuum, so that they're able to reach their full potential and live satisfying lives. The World Health Organization describes mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Being mentally healthy means being resilient and able to cope with difficult times, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationships. We all experience periods when we feel stressed, worried, anxious, sad, afraid, or angry. These are all normal emotions. However, when these emotions become severe enough that it interferes with a person's ability to function daily, and these feelings become persistent over time, then it can develop into a mental health problem. There are many different types of mental disorders. When left untreated, mental disorders can be chronic and long-lasting, and are associated with increased disability. They significantly have an impact on daily functioning and frequently interfere with family, social, and work responsibilities. Fortunately, there are effective treatments and evidence-based interventions available that aim to help individuals understand and cope with symptoms of mental illness. However, very few people with mental disorders access existing treatment services. This may be due to barriers such as the stigma attached to seeking help, the lack of understanding of mental health problems, uncertainty of how to get help, or the fear of disclosing mental health problems. Research shows that stigma remains one of the biggest factors preventing people from seeking help early for their mental health problems and getting the appropriate support they need. It is important to acknowledge that we all have mental health and have a personal responsibility to learn how we can improve and maintain our well-being in order to lead meaningful and satisfying lives.
Welcome back, viewers. Before we went on the break, we were discussing mental health, and my guest is still Dr. Olusegun Shoyombo. He's a consultant psychiatrist with National Hospital, Abuja. Thank you very much, doctor. I'm so happy I have you here. I'm learning a lot. Okay, so COVID-19 is on right now, and families are going through a really tough, families, even individual, people are going through a lot at the moment. I don't know how we're going to say, but how do we advise, how do we begin to manage this season? Number one, there's already fear. Am I going to die? If I get it, do I die? What's going on? There's so much, but how do we speak to people? Let's say everybody watching you today is a patient and has come to complain. Now, this season is just not it for me.
Well, the first thing is that people should understand that they are not alone, okay, in being anxious. These are uncertain times. Yeah. You can see that no country was prepared for it. Now there's no senior, there's no junior, there's no first world, there's no third world, there's no developed or developing country. We have done far better than some countries with a lot more facilities. And, there's something called epidemic preparedness. of countries where they rank countries and say this is countries the most prepared to handle all those ratings, PM inside water this period. Okay, so people are not alone in feeling anxious. There are uncertain times. At some point, we couldn't go to work. Children too are still at home. They can't go to school, save for the GS3 and SS3 that have been allowed to go back. Undergraduates are still at home.
Yeah,
okay, so imagine people whose business is what puts food on the table, and they're not able to go to do those businesses. So apart from anxiety of catching the disease, you have people worried about whether they will be laid off in their companies or whether they will not be laid off, whether they will get full salary or 50% or 30% or whatever. So you have anxiety centered around all sorts of things. And then you have people in abusive relationships where at least when you go to work or to school, you escape the abuser. And now people were logged in with their abusers for weeks on ending, with nowhere to escape to. Remember, this abuse is maybe not only physical abuse. Somebody who keeps saying negative things to you, abusing you emotionally and psychologically and sexually and physically and things like that. So there are several reasons. People stocked up food in their houses. They didn't know how long.
Thinking it was just going to be 2 weeks.
Thinking to just be 2 weeks, and then you are running low on supplies. You don't know what is going to happen. So not to hammer too much on the problem.
Because that's the reality of what we are facing.
So we just have to establish what the scenario is, and people to know that it's all of us. Now it's not, when it started we were saying no, it's a rich man's problem. Now we know that it's not a rich man's problem. Anybody can succumb. Before we say it's only older people who have comorbidities. Now we've seen much younger people, we've seen children succumb to the disease. Okay, so what should we do? The first thing we should do is to take care of our physical health and to respect and obey the guidelines given by the NCDC, the Nigerian Center for Disease Control, and of course the Presidential Task Force on COVID-19. So maintain physical distance, wear your face mask, face shield, sanitize your hands, wash your hands, avoid large gatherings. Our situation would have been fine. I am proud, honestly, a lot of people will not like this, but I am proud of the way Nigeria as a country has handled the COVID-19 pandemic. But we would have done far better if citizens were responsible enough and showed respect for the guidelines. At the beginning of the guideline, you will hear that somebody traveled from Kano to Lagos, somebody sneaked in from Ekiti to this one to go and deliver. And you know, and they exposed people unnecessarily, and that was why we had a spread of the infection. If we had respected that initial lockdown, we would have enjoyed. So people should respect these things and take responsibility for protecting themselves. Okay, so do all the guidelines. Now you are staying at home. Do you exercise? So people should get some physical exercise, because do you keep your environment neat and keep the mosquitoes away? One of the things that worsens anxiety is that this is not a period to be ill. You have catarrh, you think it's COVID. You have malaria, you think it's COVID. Anything wrong with you now, you will be scared that it is COVID. So that you don't have to suffer that fear, do everything that you should do. Boil your water, wash your hands, keep the mosquitoes away, do physical exercise. People have pre-existing conditions. You can imagine the kind of anxiety somebody has if he's diabetic, and every day you are watching television, they keep talking about diabetes and COVID-19 diabetes. But what do? Respect your dietary restrictions, take your medications, and check your sugar as often as you have been advised to do. Okay, so people who smoke, remember that this virus really is bad on the respiratory system. Okay. Now smokers already have compromised their own respiratory system, which means that they will fare worse if they get infected. So it's time to stop smoking. But it's almost like a tall order, because in this anxious state, what is likely to happen is that smokers will increase smoking as a way of coping with the anxiety. But we've got to provide that information that no, you should be exactly in the opposite direction. You should actually stop smoking to boost your chances of survival should you come in contact with the virus. Okay, so these are all challenges that everybody deals with. Unfortunately, the palliatives didn't go very far. I mean, we are 200 million people. How far can it go? And nobody thought it would go this long. So we've got to be our brothers' keepers. We cannot rely on government alone to provide help for people. So each and every one of us, people around us, and I'm proud of Nigerians again. People did a lot of that. People were sending monies to their children's teachers.
Wow.
You know, people have people around them that they know that this person has not been going to work. People send food supplies and things like that. So we've got to continue in that spirit and weather this storm together, because all of those things are anxiety allaying. Okay.
Because the season, and that's very true. You know, you're not. I like the beginning statement. We are all in this, together. So don't think it's peculiar to you. You know, your own is to do the best you can to keep yourself. So now, spirituality and mental health, you know, it is a Christian channel, you know, what's the relationship, your spiritual state? I know that's one of the definition of health. I think recently they started putting in the state, your spiritual state. So how do you marry the two with your mental health? Does it have any positive effect, or does it have a negative effect on your mental state?
Well, it's a question that I will try to answer, but you will also reserve it and ask a clergy next time you have a clergy on your show, because you're asking the doctor about so you are going to ask a doctor about spirituality, and then you're going to ask the clergy about mental health, so that we then balance it together. But to answer your question, we found that spirituality helps. We do not discountenance people's spiritual beliefs, but let us not talk about spirituality helping first. Let us talk about the cause. What causes mental illness? What causes these mental health conditions? Because we're in an environment where once somebody has a mental... Look, if somebody gets in an accident and breaks a limb, nobody goes to look for any bishop or venerable to come and pray for the person. They go to the orthopedic hospital, or at the very least, they will go to the traditional bone setter. But once it's a mental health condition, hospital is the last place they come. They will go to church. They will pray and pray and pray. It is when the person breaks one glass, destroys one microphone, one speaker, the pastor will say, take this person to the hospital. And it's like that with other religions too. It is because of the conception that, the misconception that this is a spiritual attack.
Because even if
maybe I shouldn't even use the language misconception, because that might not sit well with some people. People are entitled to their beliefs. But what I always say is that when you have malaria, don't you pray? If you have malaria, you pray for God to heal you. But most likely you also use the anti-malaria. If you get in an accident and break a leg and they are taking you to theater for surgery, some people will be outside and praying that the surgery should succeed. If the prayer alone can take care of it, you shouldn't go to theater. They should just put you there and pray over the leg. Maybe some people's anointing can do that. But what we are saying is that we work in synergy. We are chasing the same thing. We are pursuing the same thing. We want the person to get well. Okay, so if I, as a psychiatrist, I'm seeing a patient and I'm treating a patient, by all means, the patient can still have prayers by their religious oversight. So while I, as a doctor, will not say to a patient, don't go to your bishop for prayer, the bishop should also not say to the patient, don't go to your doctor for medications, because we are trying to achieve this thing. And I'm not massaging the ego of our spiritual leaders, but I tell them that we are not in competition. You are superior. You are superior. Because I have to see the patient to treat the patient. But somebody can bring a picture to a bishop and say, my son in London, bishop, pray for him. And the bishop will pray for him, and God will answer the prayer. So they are superior. We're not in competition. But people, there's a biological basis, so that I don't get too into too much comedy and lose the essence of the time. There's a biological basis to this mental health conditions, and their treatments are available for various mental health conditions, and people should have the benefit of treatment. People shouldn't suffer unnecessarily. We are not saying don't pray. Again, I will go back to malaria. Why malaria? Let's talk about COVID. Several people have had COVID and have recovered. Unfortunately, some have had it and have died. Okay, the same treatment that people got. So when we treat people, we say, even if this treatment works for you, it is still a miracle.
Yeah.
It is not only a testimony when you say, oh, I threw away my drug and God healed me.
Yeah.
If I use my drug and I got well, it's as well a miracle. Because it's not everybody that is treated that gets well.
Yeah. You know, one of the reasons why I was even looking at this question was there was recently, not recently, but I think earlier in the year or end of last year, there was there was this room in this, I think in the north, where they had people who had mental problem in the Kano, and they locked them up in a room in chain and put them and they starved them. And the whole idea was that the demon that was infesting them would leave them or something like that. And there was even one that trended one time years ago in, I think, Calabar, where there was a boy that was thrown away and he was eating from the garbage bin because the mother thought he was a witch. And, you know, not knowing that the guy just had some mental issues and just needed a little treatment here and there, and they got better. That's what I was asking of the issue of the spirituality with the pastor. But now you notice you have a problem. Who do you go to? You go to the hospital, isn't it? So what's the procedure? I notice, I know we're not in details here, that's why it's a bit difficult to put some of these questions, but you notice, you really cannot take care of yourself, or you find out that you're hearing voices and, you know, and you start acting funny, or your family notices. How do they then approach the hospital? Do you go and say, the guy is hearing noise and something is wrong with him, or I think he's going mad or something? So how do you do that? At
some point, I hope we'll have the opportunity to talk about certain symptoms of different conditions. We can't talk about everything due to time constraints. Just as it's difficult to pose the question, it's also difficult to answer it because there's no straight-jacketed answer to this question.
Okay.
Because we're talking about spirituality, I would like to start from there. I don't mind that when people are ill, they go to spiritual oversight, either to the pastor or to the imam or to the traditional healer. Okay? What I would like is for our spiritual oversight to be knowledgeable enough in mental health conditions and in the referral pathways to say to their flock, go to so-so-so hospital, go and see so-so-so person. Oh, I will go with you, and I am still praying with you. Okay?
Let me come in there. So it's important, or it's very necessary for our pastors and imams and traditional healers to at least have the basic knowledge, you know,
Yes.
you know, to be able to say, oh, I noticed this, I can call so-so, because I know in the churches you have doctors, you have people that can help with that. You know, that's the point
that's the point I'm making. Okay. Of course, people by themselves can go to a hospital. You can go to your family physician, your general practitioner in your neighborhood. Once you have any strange feeling, any strange symptom that you think you want a medical opinion about, feel free to go to a hospital, and then you'll be pointed in the right direction to go. What you shouldn't do is to keep it all to yourself. Talk to someone responsible and adult that can point you in the right direction. So going to their religious oversight is fine. The problem is that the religious oversight shouldn't sit on those cases, because you've given examples. Now, not all those centers, like you mentioned in Kano and Calabar, there was one in Lagos, and they're all over the place. They are all over the place, okay? The kind of place where people take people to when they are mentally ill and they chain them, they begin to flog them and do things to them and all of those things. Now, they are not limited to religious organizations, okay? It's not all about exorcising demons and things like that. Some people are just into such traditional practice, you know, no regulation, nobody regulates them, nobody trains them. Rights of patients are not respected. The question I ask, really, because the person who is mentally ill did not take himself there. It was somebody that took him or her
recommended
there and say, treat this my son for me, treat this my husband, treat this my wife for me. And I tell people, anybody can be ill. If you are ill, will you want to be treated that way? Will you want to be chained down? And then do you want to be flogged with horsewhips, deprived of food, and things like that? It is all about respect for the dignity of human life. if you respect the person and you love the person, you shouldn't put the person through that kind of treatment. But it is not enough for us to tell them where not to go if we do not tell them where to go. So there are hospitals across the country. One of those examples you shared was a documentary. It was an investigative journalism where they went and dug. Now, that was what they specifically went to look for. That doesn't mean that is the only type of service that is available in the country. There are 8 federal neuropsychiatric hospitals in this country.
In Nigeria, okay.
That means that 8 hospitals solely committed to the care of patients with mental health conditions owned by the federal government.
Okay.
8. The way you have orthopedic hospital, the way you have ear hospital in Kaduna and the National Eye Center and things like that. There are 8 federal neuropsychiatric hospitals in different parts. Lagos, Abeokuta, Calabar, Sokoto, Meduguri, Kaduna, 8 of them.
And they're fully functional, even
fully functional.
Okay, because there's always this misconception that all the hospitals, the mental hospitals in Nigeria are dilapidated.
No, they are fully functional.
Okay.
You as ACNN can pay a visit. Kaduna is very close. You can pay a visit to some of these places, because if we put it out there and people see that these facilities are there, perhaps they will be more convinced. Now, away from the neuropsychiatric hospitals, every teaching hospital, you can't have accreditation without having a department to provide mental health services. All the university teaching hospitals have departments of psychiatry. The federal medical centers, a lot of them, many of them, if not all, will have a department of psychiatry with personnel there to run it. And then you go some states have psychiatrists in their employ in some of the general hospitals. Now, we are nowhere near having enough.
Of course, looking at our population, in fact.
In fact, we have less than 1 psychiatrist to 100,000 persons in Nigeria. Less than 1. If you go and look, there's a map of the distribution of mental health personnel across the world, where Nigeria and most of Africa is a red belt, where we have less than 1 psychiatrist to 100,000 population. And even these few we have, as you can see in recent times, we are having mass exodus of our health workforce. Okay, so we do not have enough, but we have something, and people should do their best to get service from those places.
You are a professional, because my time is going up. I know we're supposed to discuss anxiety, but we're going to discuss anxiety in the next episode. Anxiety disorder, we'll talk about that. But you're a professional, in this career. Is this a career, because I'm thinking of of course I'm aware of the mass exodus of doctors. There's high demand for doctors, especially Nigerian doctors, actually. I mean, anybody who sees you now is looking for you quickly.
I should go.
No, don't go. We need you here, please. We need your services. Okay, so it's very, it's people are really going, but we need to replace these ones that are leaving. Is this an area to encourage people to come into? Is it something you would advise somebody? Why don't you take up, if you can, because I know it requires a lot of investment, and you need to be very intelligent upstairs to be able to, is it something you can advise somebody to take up this profession? You would be happy.
What profession is that? Being a doctor?
Being a psychiatrist. Okay, psychiatrist in particular, because we don't have a lot of, we're on the red belts, we're really low down there.
Let's talk generally first.
Okay.
We are bleeding doctors, we are bleeding nurses, we are bleeding professionals in different fields. We are not producing enough also. Every year you see the number of people who write JAMB. Only a small fraction of them are able to gain admission into universities for whatever course they want to study, not medicine alone. So we do not have enough schools to absorb our population. And that's why you have a lot of people, because of the problems of securing admission, you now have people all over the place, in Ukraine, in Hungary, in Oman, in Libya. People are going to everywhere to go to school. Now, even the young ones that we are producing, the aim is graduate and jet out. Okay? The aim is for them to graduate and leave. So those of us who are already in the profession, people like me, our seniors, we've got to give a lot of encouragement. And we have to appeal to the patriotic sense of our people. We cannot remove that. Nigeria cannot enter into a wage competition with Canada and Australia and the United Kingdom. We can't pay what they pay. We simply cannot. So if the argument is that they pay so in America, all we can tell you is good luck. Because we can't pay you. I mean, you, for example, can come and say, ACNN, how much are they paying me when CNN can pay me? So we have to appeal to the patriotic sense of our people. That there must be people here to treat our own citizens. If I travel out, am I going to travel out with my entire village? Or when I travel out, I'll now be calling people that stayed back. My mother is in the emergency. My sister-in-law is in the this thing. Please go and treat them. We are not blaming those who go. We want different things in life, and there's mobility of labor, but we must appeal to that patriotic sense. We do not only stay back to treat, we also stay back to teach. Because we were trained by some people, and there's a generation of doctors coming up who will need quality doctors to train them. If they don't have quality trainers, what kind of specialists will they be?
Dr. Shoyombo, thank you very much. We're still coming back. I'm not leaving. I said I must drag everything I can pull out of you before you go, because there are not lots of you, you know that. So when we get this opportunity, we take full advantage of it. Thank you very much. On our next episode, we'll talk about anxiety disorder. Now, I don't think, what I want to know is, people can be anxious, but why is it a disorder? Isn't it just, we are anxious or something?
Maybe we should close this episode by laying the foundation. Just as we talked about mental health being an umbrella, that umbrella is a very big umbrella. And when you talk about anxiety disorder, it's also an umbrella.
Wow, okay, because my time... So there's a lot to talk about. Okay, sure. All right. So thank you, viewers, for staying with us. For the past 15 minutes, I've been speaking on mental health. We've learned so much today, and my guest has been Dr. Olusegun Shoyombo, and he's a consultant psychiatrist with the National Hospital, Abuja. I'll see you next week, and we'll be talking about anxiety disorder. Please stay tuned to ACNN to learn more about this anxiety disorder. God bless you. My name is Angela Mweze.